In this video, we'll discuss the symptoms of a very common problem, and that is fatty liver. Hey Wellness Warrior, I'm Dr. Zyrowski, and I want to help you avoid getting fatty liver. And if you have it, which there's a good likelihood that that could be the case, I want to help you reverse fatty liver. So let's go ahead and dive right in and talk about some of the top symptoms we have to watch out for. The first one is going to be trouble concentrating. Now, the reason that you have trouble concentrating is because when you have fatty liver, it usually is going to come as a package with a lot of other symptoms, and one of them is blood sugar irregularities, going up, going down, causing highs and lows with your blood sugar, causing fatigue in your ability to concentrate. Next on our list is going to be fatigue and weakness. Now, this is something that's very common. This isn't going to be just like, oh, stayed up a little late, I'm a little bit tired. This is every day. You have this chronic fatigue from morning till night. You have a hard time getting out of bed in the morning. You have a hard time keeping your energy up throughout the day, and then you're just wiped out at the end of the day. So these are two of the first symptoms that you have to watch out for. And one of the big questions that people will ask, well, how do I know if I have fatty liver? Okay, because sure, we're looking at the symptoms here, but what else can you do to kind of assure that this is a problem that you're facing? Well, there's a few things. One, it can be a blood test. That's a good way. You can look at liver enzymes, look at some other factors there. Now, the other thing that you could look at is what are some of the predetermining qualifying factors that you may have fatty liver. We're going to look at things like insulin resistance, type 2 diabetes. We're going to look at obesity. Do you have problems with obesity? Overweight. Are you somebody who has your blood drawn and you had high triglyceride levels, high cholesterol levels? Those are all things that are going to be risk factors for having fatty liver. Now, the other thing that we can do that's a really good way to determine if you have fatty liver is doing something called a fibroscan, okay? We'll take a scan of your liver with this very particular device, and it'll tell you whether or not there's a bunch of fat buildup in the liver that's causing problems for you. And so then, as you have these issues with fatty liver, the symptoms keep piling on. Symptoms like gynecomastia. This is when men get enlarged breast tissue and then it just doesn't seem to go away. Pain over your liver. So what you'll have is right over your liver, there'll just be a nagging pain that doesn't seem to go away. It'll be right underneath your rib cage, or it would be, in another way of saying it, in the right upper quadrant of the abdomen. We're also going to be looking at a swollen belly. Now, if you have a swollen, hard belly, basically the one that's just full of fluid, then that's also a sign of fatty liver. And we have to make sure that as we see one symptom after another, we look at ourselves and go, do I check that box? Do I check this symptom? Do I check the predetermining factors, the risk factors of fatty liver? And then we also have to look at what is my risk of getting fatty liver? And the reality is it's pretty high. It's estimated over 100 million people are suffering from fatty liver. They don't even know they have it, right? It's just like insulin resistance. You're suffering from it, but you don't know you have it. And then the problem gets worse and worse. You go to the doctor one day and they say, hey, you have fatty liver, but it's so bad, it created a whole bunch of scarring and now your liver tissue is really damaged. So we're going to look at this and understand that the risk factor is high. There's a great chance that you have this. And if you look at what age range, it's typically going to be about 30 and above when this starts happening. Not to say that it can't happen lower. I mean, there's kids who have fatty liver, for goodness sake. So it could happen at a younger age, but really it's about 30 and above where you start seeing it to become a real problem today. Let's keep on going with some of our symptoms because these next ones all kind of combine and go together. Decreased bile production. And if this is happening, you're typically going to see this in the way of having a hard time of digesting fats, having a lot more bloating and gas, and just overall a lot of irritation in the gastrointestinal system. Increase in liver size, okay? Well, we talked about how you're going to get pain over the liver. Well, increase in liver size, and due to a lot of the inflammation that's there, you're going to get these issues, pain over the liver. And then as a result, you're going to get chest pain. The liver starts to get larger, it starts to compress areas in the chest. The chest pain starts after that. So these are the symptoms, these are the risk factors, but what do we actually need to do in order to take this fatty liver, this issue, and start to reverse it? Because I'm here to tell you the good news is about the liver is that it has an amazing ability to heal and regenerate. It's phenomenal. It's so interesting. You can lose part of your liver and it'll grow back. It's really cool. And so with the solutions, first of all, we have to clean up our diet, okay? If you're not cleaning up your diet, you're wasting your time getting to any of the other solutions, right? So diet first. It's gonna be the strongest tool that you have to reverse this problem. So clean up your diet, following a sugar-free diet, a grain-free diet, a low-carb diet, following a diet like the ketogenic diet, the carnivore diet. These are both going to be really good diets to help drive the blood sugar down and help strip the fat away from the organ systems. Now, what we can look at after diet is exercise. Start exercising. You know, whenever we're trying to heal our body naturally, we don't want to just do one thing. A lot of people get hung up on one thing. What's the perfect diet, right? Well, it's not just the perfect diet. What kind of diet? What kind of supplementation should I be using, right? Because if we start to stack all of them, we're going to get great results. Now, as far as supplementation, there's some really good things you can use. You can use things like alpha-lipoic acid, N-acetylcysteine, milk thistle is phenomenal, right? We want to make sure that we use some of these different nutrients in order to help repair our liver. And then on top of that, we can do things like intermittent fast. And then, even to take it a step further, what we can focus on doing is making sure that we avoid toxins, because the liver is responsible for removing toxins from our body. So making sure that we're eating good, clean food, we're making sure that we're not having chemical exposures on our body, on our skin, that are in our beauty products, on our clothing. Make sure that we're reducing chemical exposure. And then as a result of all of that effort, your liver will start to heal and you'll get your life back. I hope you enjoyed this video. I'm Dr. Zyrowski, and if you like this video, I think you'll really like this video over here next.